Hello friends, welcome back. We shall continue with our study of pharmacological actions, and in this particular video lesson we are taking at one very important action, which is that of palliation. In fact, palliation forms a big and a major pillar in medical practice all over the world in all forms of medications. If we were to define palliation, we could do it in very simple words. It is medication which is given to relieve or lessen disease symptoms without curing. Just as simple as that. There is no aim at curing a person. In fact, most of these conditions are unfortunately what we call as uncurable. For example, let us take where palliation is used, and there are a number of them, and this is just a small selection. Cancer, for instance, nobody can claim to have any cure for cancer. All that is being done is palliation at every level. Parkinson's disease, Huntington's disease, heart failure, congestive heart failure, stroke, even HIV and AIDS. It's not curing, it's only palliation that is used. Dementia, COPD, pulmonary fibrosis, and now in the present times, COVID-19. The United Nations World Health Organization has openly admitted that they do not have a cure and there is none in sight for quite some time. So the only line of treatment is palliation. Let us see how targeted treatment versus palliative care compares in the final 3 days of life of a terminally ill patient. Here is a very interesting Italian study which was conducted, and it compared hospital care versus hospice. As we all know, the hospice does not give any targeted treatment for the disease, but only makes life more comfortable before a patient passes on or dies. They found that 75% of hospital patients were being given 3 or more inappropriate drugs. And this is in the last and final 3 days of life. Isn't that terrible? And diagnostic procedures were more frequent in hospitals, even when they were unnecessary. You can just imagine the misery that a patient has to go through, especially in the terminal stages or at end of life care. Here is another study which was published in 2017 and which asks a very relevant question: when is palliative care necessary? It says in terminally patients, treatment targeted at disease did not show any improvement in overall survivability. That means all efforts towards targeted treatment of disease were just a waste of time, and they were just a burden on the patient, reducing the overall quality of life. Given these facts, is there a more gentle and reliable holistic care system which both takes care of the patient's comfort, quality of life, as well as providing support? Because homeopathy is not just about medicine, it's about the concept of total care. And the answer for that is homeopathy. I'm glad you have chosen to take up this course, because this is going to be a game changer in your practice. Thank you very much for your attention, and we shall meet once again in the next lesson. So until then, bye bye and thank you.